Biliyor musun? Erken rezervasyon başladı. Yazın en renkli fırsatları cyprusparadise.com'da. %40, %50 hatta %60'a varan kaçırılmaz indirimler. Erken rezervasyon yap, uçak bileti fiyatına paket tatili al. Uygun fiyata Kıbrıs tatilinin adresi cyprusparadise.com. Zaman akıp gitmeden acele edin. Bir bakmışsınız yaz gelmiş. Cyprus Paradise. Tatiliniz bizimle güvende.
Kalitenin, güvenin, hızlı teslimatın adresi Ancon Furniture. Ancon Furniture ailesi olarak yeni ürünler ile hizmete devam etmekteyiz. Yeni model koltuk takımlarımız, yatak mekanizmaları bir dokunuş ile açılıp bir dokunuş ile kapanabilmektedir. Bir dokunuş ile açtığımız yatak mekanizmasının yatak çarşafı kullanıma hazır, serili olarak içinden çıkmaktadır. Yıl sonuna kadar herhangi bir koltuk takımı alan her müşterimize akıllı sehpa hediyemizdir. En iyi ürün, en iyi fiyat. Sadece Ancon Furniture'da. Bize uğramadan karar vermeyin. En iyisini biz yapana kadar daha iyisi yok.
Welcome to the latest printed press. I'm Aysen Djemal, and tonight we're going to be giving you an update on the COVID-19 changes and discussing the new COVID-19 vaccination as well. I'm really happy to be joined by special guests, Dr. Mekella Yesil, Public Health Researcher, PhD, Fulya Yahioglu, Senior Public Health Commissioner, Stewart, Assistant Director of Public Health at Enfield Council, and Erim Metto, CEO of the Turkish Cypriot Community Association. Welcome everybody to the programme. Thank you very much for coming on. Hello, how are we all tonight?
Good. Thank you.
Like I said, it's very refreshing and heartwarming to have you guys on the programme to reassure us and to give us the latest COVID-19 updates. I'm going to start with Erim because I know that he has to leave the programme shortly. So my first question is going to be, we have now entered Tier 4 in London. Can you tell us about the COVID project, how we're coping and what you're doing currently?
Yeah, I mean, as we know, that TCCA has been leading an initiative that helps people who have been isolated due to COVID. We also run a befriending scheme, a WhatsApp group. We also manage the food runs and special deliveries that are needed, so pharmacy items and so forth. What's happened is that we've had to claw back a lot of the work that we do down to a minimum, but there are people who are in desperate need who are still at home. So we've continued to serve those individuals. Tomorrow we've got 100 hampers going out to isolated individuals in our community, but we're going to add items to those hampers so that it means that we don't have to do a delivery next week. We need to protect obviously our staff and our volunteers, so the minimum contact that we have with individuals out there, but still recognizing there is a need out there, that we will deal with it. As an example, what we've had as an organization is meant to have something in the region of 13 drivers allocated to tomorrow's run. That's dropped down to 10 because 3 people have been in contact with people who have had COVID, so therefore have had to isolate. So the situation is it is very difficult to deal with what's going on. It is very difficult to try and change and amend what you do as an organisation, because we also run a care agency. We also have other projects around health and dealing with mental health illnesses. So all those have to be managed on an ongoing basis, and we have to change the direction we take on an almost daily basis. And I'm sure that's key with our colleagues as well. We need to react to the situation. We're not in the best place, and information that we put out today may by tomorrow change. So I think it's being fully aware. I mean, 2 weeks ago when we was talking about what was going on, we was talking about coming out of lockdown. We was talking about going into some sort of Christmas period that will allow us to meet with our family and friends and give them some sort of a movement away from isolation. That's all changed. It's changed very, very quickly. And I think what the viewers want to hear, and I'm not the person to do it, it's my colleagues to be more advised on that, is what the current situation is and how accurate it is and what they should believe and what they shouldn't believe. There's a lot of information that's going out on social media that kind of doesn't help the scenario, doesn't help the situation. So yeah, that's why we're here. I think that's the good thing about this program, because it will go out today, obviously, and there'll be people viewing it after today, and they can tap into the information that's been put out there. And I think it's important to say that as an organised as a show, what we do and what all of us do, and thanks to you again, is that if people ask for things to be clarified, if we can't clarify on this show, it'll be clarified on next week's show. If they want a speaker to cover a particular area of concern, then that will be arranged for next week. But yeah, that's where we're at as an organisation at the moment.
Yeah, definitely. I mean, the second point that I was just about to make, because you were saying we want to reassure some of our audiences, and there's been lots of stories going around. We've focused on the vaccine we did last time, and we are this time. And I know that you've actually had it, Erim. So can you tell us what it was like, and are you suffering any adverse reactions as well?
I mean, so the way it's come about is obviously what's happened is the target group is the most vulnerable within our community to get the vaccine first. So that's the over 80s and so forth. However, care agencies and those who are working in hospitals and in clinics and so forth are also offered it. The tendency, what I've noticed, and I could be wrong with this, is that if there is an unallocated amount of people, then organisations are contacted with serving the care industry, and then they will be allowed to capture those spaces. So yesterday at 6 o'clock, we was offered it from Haringey Council, and 4 of our people that work within our organisation who provide care, who are in the care arena, went at 7:30 to West Green Clinic. They had the test. We all had the test. We all had that vaccine. The way it works is that you have your NHS number, you have your doctor's name, you have your date of birth, you have the letter of authority from the local authority that says that you can get the vaccine completed. Went in there, was asked to give the documentation, then asked a seat, asked to wait in the waiting room, asked to go into a room, was given the vaccine, which was a prick on your arm, very quick, didn't hurt at all. Afterwards, you had to go into a waiting room. You waited for about 15 minutes and observed, and after that, you was allowed to go. My situation, I felt a dead arm afterwards, like someone punched me really hard in the arm. That's wearing off now. So I've had that. I felt a bit wheezy overnight, so I felt a bit kind of lethargic and a bit tired. That's near enough gone, so I still had a bit of that, and had a bit of stomach pain for maybe 2 hours after maybe 2 hours in the evening, and that was it for me. And that's all I had. Obviously, everyone's reaction will be different, and the health professionals will advise on what the situation is with that. With my father, he went yesterday. No, he went the day before. Sorry, he went on Sunday. He's 85. He was called up by the GP, so a slightly different system that works with them. He was called up by the GP and asked to make a booking if he wanted the vaccine completed. He gave a date. It was done in the Evergreen Centre in Enfield. It was a very, very sterile operation. So you walk in, the seats are wiped, you sit down, you wait till your number is called, you're shown into the room, you have the injection. Again, very, very quick. Wait 15 minutes, given a date in 3 weeks' time, and then that's it. That was the end of the operation. So
Well,
yeah,
sounds
very easy from the
very
perspective of
easy.
having
Yeah.
it completed.
Mm. I mean, Fulya, I was going to move on to you. Thank you very
Sure.
much, Erim, for all of that
I'm gonna
information and sharing
sign off
your
now.
personal. Yeah, you're going to log off now. Thank you very much for
Bye.
making an appearance,
No worries.
and we'll see
Thank
you
you.
hopefully next week.
Yeah,
Um,
definitely.
Thank you very much. Fulya, obviously you were on the programme a couple of weeks ago and we
Yeah.
spoke about the history of vaccines. And I don't know if you could just very quickly recap on that history and how safe vaccines are, and have they undergone stringent portals to be able to be given to members of the public?
Sure. When we spoke 2 weeks ago, I mean, I mentioned that vaccines have been around for a couple of centuries or more now. I mean, we've had vaccines from, I think most people know of Dr. Edward Jenner, the physician, for smallpox. He was instrumental in kind of identifying that cowpox. So milkmaids who developed cowpox, he could use the blister from that. They didn't have smallpox. They didn't catch smallpox because of having cowpox, which is a slightly less kind of, I suppose, harmful strain of smallpox. And so he figured that using some of the material from that, someone infected from that, could provide immunity against smallpox. Now, from that, all sorts of things have developed. Then we had Louis Pasteur for anthrax, cholera, and then we moved on to the 19th century where we had vaccinations kind of using the what you'd call the weakened virus or the dead virus. So things like diphtheria, things like tetanus, BCG. We're talking whooping cough. So all these things, and then you move on to the future now, which is that we're using kind of genetic material from viruses. We're using the proteins of the spikes to get an immune reaction. So they have been around. I mean, vaccines have been around for years. I mean, we were all at that age where when you went to school, you'd be vaccinated. MMR.
Yeah.
If you went on holiday to Southeast Asia, you'd be vaccinated for tetanus, diphtheria, polio, etc. So this is nothing new. And in terms of the safety aspect, we've had them, as I said, we've had them for years, and it is extremely stringent, the procedures that vaccine manufacturing and vaccine testing that you follow. You're talking about preclinical work within laboratories, within animals, and then you go on to phase 1 trials with small number of volunteers to see, assess its safety and look at kind of the dosage. Is it right? Then you go on to phase 2 clinical trials, a larger proportion that you're looking at. You're looking at the effectiveness of it, and then you move on to what's called a large phase 3 trial, which is the biggest trials that are ongoing, which uses kind of randomized controlled trials, use of a placebo. Placebo meaning that one group gets none of the vaccine and the other group gets the vaccine. And all these data that's published has to go through in the UK, the Medicines Health and Regulatory Authority. In the US, it will be the Federal Drug Agency and the Center for Disease Control, and the World Health Organization. I mean, there's loads of independent bodies that assess the safety of vaccines, and they will not be let out onto the public if they were not effective and if they didn't have any safety profiles. What people are worried about, I suppose, are side effects. Side effects, all medicines and all vaccines have side effects. Paracetamol, you take paracetamol at a large dosage, you will get your liver will be damaged. If you take Nurofen or ibuprofen, you can get stomach ulcers. So all vaccines and medicines have side effects to a degree. As Erim pointed out, the side effects from the COVID vaccine at the moment for the BioNTech Pfizer one is that you've got a bit of a sore arm, you can feel a bit queasy, you might have to stay in bed for a day, you might have some shivers, but no more than that. There has been a couple of cases of hypersensitivity to the vaccine, and that's because people, I think, weren't aware that this was, if you were particularly hypersensitive or you had an anaphylactic reaction, you had to notify once you were being vaccinated. So that's where that came from. So absolutely safe. I would tell people, vaccines have been around for years, and we have used vaccines to obliterate diseases. Smallpox was obliterated in 1979, early 80s. I mean, it killed 1 in 3 people, and it was highly contagious. So,
Yes, and we've got lots of comments coming in. I don't know. I mean, at first, I might want to ask Mek this question, and then we're going to go on to this because I think Ilhan is very concerned about the vaccine, and he's asked lots of questions about it. But Mek, at the moment, the biotech, but he's specifically talking about the biotech one, so it'd be quite good for you to just have an explanation first. At the moment, the biotech vaccination is the one that's being pushed out. Right. I'm aware that other vaccinations are being produced ready for the UK, but can you please tell us the differences between the vaccinations, and will we be offered a choice?
Right.
Mekella, Dr. Mekella.
Right. There's no choice at the moment, but the one that we've got, which is the biotech PIPSA one, that is the one that's been rolled out at the moment, and they're planning to. Obviously, it's already gone into circulation now, as Erin mentioned earlier. So obviously, the ones who are more vulnerable will receive that vaccine first, because that's the one that's obviously past the phase 3 trials. The Oxford one, although it's past the trials, won't be available until January, I believe. I'm told anyway. I think that's what they said for the area in London and what have you. But the one that's going through at the moment, I said you said somebody called Ilhan was asking some questions.
Yeah, Ilhan Kaplan. I'll go through his questions in a moment. He's asked a variety of questions.
Okay, right. So basically, it uses an mRNA messenger. So what it does, it doesn't give you the real it doesn't give you the real virus. It's a copy of the virus. So basically, it's made in a lab in a little small nanoparticle. It's injected into the body. Your body is then made to. Your body's cells make antibodies against it, which means your body builds immunity towards it. But it doesn't work on the same assumption as what I think he's going to ask anyway. I'm not sure, but because a lot of people are asking me about hydrogel and stuff like that. That doesn't. It's nothing like that. Obviously, there's different components in the vaccine, so it doesn't. Nothing along those lines. Because somebody was messaging me earlier, so I don't know.
I'll quickly go through some of his comments. Let's go through it. It's more to do with the conspiracy theory, I think. But let's just go through it just to reassure him, because people like hearing these things. And it may, I know you're the scientist and it sounds ridiculous, you're the experts, but for a lay person who maybe perhaps doesn't know, it is quite a scary time. So let's just go through it and then we can reassure our public. Ilhan Kaplan's put, there's a serious argument that there's hydrogel inside the the biotech. They say there's I mean, I can't even say this. Technological inside the hydrogel. Is that true?
No, absolutely not.
Absolutely I mean, it was all written in the past. I need to know for sure. People don't trust the COVID-19 vaccine because they think they're taking the mark of the beast. What are we going to do? Just accept the vaccine? And then he's put another comment further down. Also, are we going to have quadrum dot tattoos under the skin so that they can see we're vaccinated? How do we know the vaccine won't affect us in the future? That's all his comments.
The biotech vaccine, the technology that they've been using for the mRNA has been used since 2005. And originally, mRNA vaccines were used to treat cancer patients. So the professor that created this vaccine, they were mimicking, obviously, cancer cells to sort of like cure patients, which they have. And obviously, when the trials were being taken place for the biotech vaccine, there were no fatalities, obviously, so we know that was proven safe anyway. And it was 10,000, then 30,000, then 40,000 people took part in the study. So we know that this type of vaccine will not cause any harm. Obviously, the side effects are people who are immune compromised or who have the thing with the anaphylactic shock, who have to carry an EpiPen. We know that, so that's not going to affect them. Not having the vaccine will be more catastrophic than having the vaccine. And that's my honest opinion.
And a few people have actually said, before we go on to our next question, Suleiman Tozun has said, I totally agree with Fulya. I had vaccination in the Far East. And then somebody else here, Abi Hussein, has also said, I went to Africa in the 80s, had half a dozen vaccinations in order to travel and return to the UK. So people are saying basically vaccinations have been around for many, many years.
Yeah.
And obviously a lot of research got into it.
Yeah,
I think there are. Sorry, Glenn.
Yeah, Glenn. I was going to go on and ask you a question, but please, yes.
Yeah, Mekella is obviously much more scientific than I am, and this isn't the most cogent argument I've ever heard. But in terms of being hacked, someone was saying to me, "This is a government," and I wouldn't repeat this outside here. But this is a government that can't organise a test, track, and trace system when we give them our phone numbers, let alone take technology that doesn't exist yet, inject it into us, and then trace us around the country. You know, it's a level of like technological competence that's like so far in the future that even if we wanted to do it.
Well, I think if we're talking about tracking, we're already being tracked by, you know, your phones. You've got your mobile phones; they know exactly what you're doing. I mean, so I don't think the vaccine. No, absolutely not.
Has any link with that whatsoever. No. I mean, I'm glad because, I mean, I hear these stories and it is quite ridiculous for me as well, because obviously I've had the privilege of being exposed to your wonderful scientific knowledge for quite a while now, right from the beginning, from March. So I've been, you know, I've been reassured, but it is going around and people are being scared. And I think it's vital, especially for our elderly, that they don't hear these things, that they hear the true facts of how these vaccinations work. I mean, Glenn, thank you very much for coming on the program. Can you tell us why you feel it is important that we take up the vaccine when offered? And as time goes on, what other places the vaccinations may be available to us?
Okay, so in terms of why it's important, well, everyone's been through a really quite difficult year. We did see a spike in deaths in the first wave between March and May. In Enfield, there's usually about 2,000 deaths a year. In between March and May, we had about 500 more deaths than we normally expect at that time of year. So people die all the time. We were monitoring that, and you could just see the graphs go flying up. It was just, you know, in terms of the population, it was a disaster. So absolutely, I think, you know, have the vaccine. There's only one way out of this crisis, and that's for people to be vaccinated. So you know, I can't put it much more simply than that. If people are, if people are really asking or interested, so in September, in September, I wrote something for the Over 50s Forum, and essentially talking about the vaccine. And in that, I was saying that, you know, my surname's Stewart. Would I be asking my parents to have my mum and dad to have the vaccine? It's not, you know, and my sort of reply wasn't really, I wouldn't be asking them. I'd be saying to them, definitely have it, like telling them to have it. And I suppose the other sort of slight make it about me because I'm the most important person in the world, obviously.
Not at all, but you're an expert, obviously. So.
No. But if people are, you know, so as Fulya was saying, there's phase 1, 2, and 3 trials, and phase 3, you're getting into thousands of people being tested for, you know, what the effects of virus might be. Sorry, what the effects of the vaccine might be, both on the virus and on the body. And when this came into being, like loads and loads of scientific establishments started to try and develop a vaccine, which is all to the good, because if one vaccine fails, another one can come take its place. Well, I'm on a phase 3 trial myself, so like, you know, I'm not worried about this at all. I think there's one way out of this, and it's to have a vaccine. So that's why I think it's important.
And I think it's also good to remember that this is a global pandemic, and everybody everywhere in the world is working towards getting these vaccines out. Absolutely. So it's a collaboration between academic institutions, in pharmaceutical companies. So it's very much a collaboration. So I think absolutely we need to get the vaccines out to go back to normality.
Do you think we will? I mean, that's one of the questions that's coming up now. Do we think that if we do get vaccinated, that we might actually be able to go back to some sort of normality?
Yeah, absolutely. Yeah. Like, there's no sort of debate about that. Yes,
it will.
Mekella, I've got the next question is for you. People are worried about this new strain, as I was, you know, hearing about it a few days ago, or with all the flight bans again, us all going back into lockdown. It is really concerning. What does it mean? Will the vaccine be effective for this new strain? I know we spoke about it off
the vaccine will still be effective against this strain. It's the same strain, but all it's done, the virus has lost its genetic material. So as it's progressed throughout the last couple of months, some of the codes, some of the what we call the math material has lost its path. So basically, where it had 30,000 genetic numbers, it's only got I think 17 and 20 have disappeared. So it's become not stronger, but it's more contagious. So it's more transmissible. So basically, it's getting weaker, but it's more contagious. So the fatalities are less, but the numbers are getting higher because we've given it a chance to, obviously, we've maybe not so much with not wearing masks and social distancing, but where we've had lockdowns, then unlocked again and gone back into public places like restaurants, schools opening up in September, which is the biggest one, because this is where the mutations are coming from. Children are the ones who are spreading the disease. It's not the adults who've been wearing the masks and washing their hands. It's sending the children back to school, and then obviously having a 2-week break before Christmas, going back to school, and then a few days before Christmas having to lock down again because the numbers have gone up. So it's the same strain, just some of its genetic material has been lost in the process, and that's what we need to sort of like tell people. It's not a different strain, it's not a more dangerous strain, it's just become a lot more transmissible, and that's why it's more contagious.
Yes, I totally agree. And it's, you know, when you think about it logically, it all makes sense. Gulnil has put a very good comment up, actually. I think we need to address this, definitely.
Sure.
She's put, I think the best way is to have the vaccine, which we've obviously established, but I'm worried about the timescale. My grandparents were told by their GP that they have to wait around 3 months before getting the vaccine. They are 72 and 74, so I am worried. How are they prioritising who gets the vaccine? I think this is a very good point. Out to whoever wants to answer.
Well, obviously, the more vulnerable ones, more likely. But go on, Glenn.
Sorry, I'd be surprised if it's 3 months. So there's essentially they're working through from ages 85 plus down through the population, and the peak. They're talking about peak vaccination being around sort of April, May, but by then I'd be surprised if we're not way past age 70 plus.
I think it'll be quicker than what people think. Actually, it's actually they're going to be getting through.
I mean, obviously, obviously it depends on the logistics and rollout and how many people can get trained to do the injections, and there's lots of moving parts in this. But that almost sounds like, I mean, I hesitate to say this, but it almost sounds like the GP saying 3 months so people won't keep ringing the practice.
I mean, I suppose if you're offered it, then you should go for it, right? Because then you might not be offered it again for a while. I think that's probably the point. Fulya, I know the answer to this question now, obviously from our conversations, but I'm going to ask it anyway. You're a scientist and a respected person within our community. Will you be taking the vaccine? And if there is any reason for you not to take the vaccine, can you tell us? I think I know you'll probably say yes.
No, I'll definitely take the vaccine. I have two parents who are immunocompromised. I know that in order to keep myself safe and for them to be safe, I need to be vaccinated. I think it's important that people understand that if we don't get vaccinated, I mean, we're in a position now where, you know, we've had appointments for routine procedures being cancelled, starting to be cancelled now. My mum's kind of oncology appointment has been cancelled because of the strain. You know, if we don't do something about it, if we don't get vaccinated as a majority, then I don't think we will go back to normality. And I think it's going to cost us more in terms of an economic problem. We already know that businesses are suffering, but it's more of a health problem. You know, people won't be able to get cancer treatment, liver transplants, fertility treatments. I think, you know, in order to get back to normality, we will need to be vaccinated. And I will certainly take up the vaccine, knowing the information, knowing people who've actually died from the virus itself. People assumed that it wasn't out there once we had the easing of the lockdowns. No, unfortunately, it's out there. And particularly this strain is more transmissible. We just have to be very, very careful. I think the only way out is to have the vaccine.
Vaccination, absolutely.
Yeah. Glenn, this is a question that I personally want to ask, actually. Will there be an end to how we lead our lives? Like, you know, with all the social distancing, masks, no contact. I mean, as an expert, when do you foresee that that will go back to some sort of normality?
I mean, there's a question for you. I suspect that, you know, once we get the older people and vulnerable people vaccinated, the death rates will come right down, and then we'll start returning to normality. I think there will be a new normality, so people may be more willing to wear face masks at different times from that. I think people are likely to sort of work from home much more than they are now, or than they were pre-COVID. But in terms of when, mean, I'm hoping towards the end of February, if we can get the vaccine rolled out in sufficient numbers, then I think we'll start to return into normality. The caveat to that would be that obviously people have to have 2 jabs. It's 3 weeks apart, and then I think it's Mekella going to know this better than I actually, but either a week or 2 weeks after that before
3 weeks, 21 days.
Yeah.
3 weeks.
So 3 weeks apart, and then a week
4
or 2
weeks,
weeks.
1 week after that, 4 weeks.
Yeah.
So if you had the jab now, it'd take a month before you were properly vaccinated.
Yeah.
So there's obviously a rolling program in this, but I'd hope, end of February, we should be start thinking at least return to some sort of normality.
Because, I mean, obviously it's quite a worrying thing. Businesses yet again have been closed down. I have a lot of, it's funny actually, because I've had so many of these programs, I've had a lot of local business owners contacting me personally saying, when do you think we're going to reopen? When do you think? And I don't, and it's really hard for me to have the answer. I mean, so I'm asking you guys, obviously I don't think you've got the answers, but predictions wise, do we think we'll go back to some sort of normality in January, in February? What do we think?
I think January is too soon. We're going to see a few more fatalities before then, unfortunately. We're going to see a few numbers go up. And I reckon, this is just me speaking off the record, but I reckon we might go into like another lockdown in January if we really want to bring numbers down.
I think we have to. I think with this variant strain, I think the way it's going,
or close schools perhaps.
Yeah, we will be heading for another
2 weeks,
lockdown.
just to bring the numbers down, because we know that this new virus is more the variant virus is more dominant within children under 16.
I think have a longer holiday break, get those vaccinations done, and then reopen it. You know what? I don't think
2 weeks in the summer
disagree with that. I don't think the public would disagree with that. And obviously for travel, I'm assuming there will be some sort of COVID passport or something detailing whether you've had the vaccination.
Well, we don't know at the moment.
Yeah, the government said no to that, but you can see a situation where airlines, etc., are saying you're not traveling unless you've been vaccinated. So it may not be the government, it may be through other pressures.
Other airlines.
Other countries, perhaps.
Other countries, you know, venues, events. You may not be able to do a number of things unless you've been vaccinated.
I suppose until you get the variant under control and as you start vaccinating, and the more you vaccinate, the more you'll get in control. And if you have social distancing measures to stop people mixing, because this variant is so transmissible, then I think then we'll achieve what we want to achieve, which is that we would have got a handle on the virus and hopefully go back to some kind of normality within Easter, hopefully.
Yeah, I reckon 3 months.
Yeah, we've got 2 sort of questions coming up. Ilhan has written lots of things, but I think his main point is the psychological effect that this is now going to have on people. I don't know if anybody wants to comment about that. I personally think it's had a psychological effect on me. It's had a psychological effect on my older son, who's in year 11, because he's toing and froing about exams and all sorts. So it's added on anxiety and pressure. So I think everybody has been psychologically affected. But what sort of advice or strategies or I don't know,
talk about it. Talk to people. You know, let them get it out of their system is one of the things that you can do. And obviously look for the signs. You know, are they going to staying indoors isn't the best thing to do. No. I know there's a virus out there. We do need some sort of vitamin D or sunlight, because obviously that helps with sleep patterns as well. And you don't want people getting into a routine where they're getting depressed, because obviously then there's the thing of going and getting antidepressants. We don't want that. Obviously it might be, but we don't want that at the moment. And I think it's important that everybody communicates to one another and sort of shows sort of like solitude or something, to sort of bring people together to sort of communicate more. Maybe open forums or things like this, and maybe getting those younger people like Ilhan, whoever, maybe bring them on the show and get them to talk about how they're feeling. Maybe a big broadcast.
I think it's true. I'm up for something like that. Definitely. Like I said, I at the first lockdown, for a good couple of weeks, I was very, very depressed. Obviously, through the focus of the programs and everything that we've done with the TCCA, I feel like I, came out of myself, and I still have got a lot of hope. Like I said a few weeks ago when we had the program with the vaccinations, I do feel like we are going to go to some sort of normality, but there is that little milestone ahead now, the next couple of months for sure. And we must really follow the rules now and be careful, because this new variant is quicker. I mean, someone's actually asked a question about that. Big Hash has said, why are these recent strands less fatal and more contagious? Would you elaborate this, Dr. Mekella, please?
I had this conversation with him early this morning, fair enough, because he's a doctor in India. So we know that, and I've showed him the information. It's basically the genetic material of the coronavirus is actually mutated. What it means is it's lost some of its some of its RNA, some of its spike protein. So it's a math module. So when you think of 30,000 genetic mutations all coming together, it's lost some of that mutation, which is why it's spreading more. It's more transmissible, shall we say? That's why. It's not that
it's not fatal. It's just more transmissible. I suppose. Is it more like a common cold now, or is that what's happening? I don't know. As a layperson,
no, it's just more transmissible, which means it's more contagious. That's all.
So it's easy. It's probably easier to attach into your nasal passages. That's what it is, because
spike protein.
The spike proteins have been kind of mutated, and they're able to attach a lot quicker. That's all.
Oh, I see. So you can be sniffly now with it, can you?
Well, I think we're still trying to find out how it's being more transmissible. But one of the theories is that, the spike protein, because it's changing, it might get into your system a lot quicker. And you might be able to attach a lot faster. So that's.
I understand.
Yeah, from an evolutionary point of view, it's not in the virus's interest to kill us off. It's in its interest to become more infectious, but not kill us off.
Which is a good thing, which we need to say to people. Perhaps a little biology lesson to sort of explain to people. And the mRNA doesn't affect the cell; it doesn't go into your nucleus, which is your DNA, where your DNA is kept. And that's another thing. People don't know that, you see. So
we're slightly gone over our program, but I'm going to keep going for a few more minutes. We've got one last question, and then we'll just have last words from everybody. It's been so interesting. I could talk about this for another hour, I think, because you are honestly giving us a lot of hope. You're very hopeful, and it's so reassuring, it coming from the experts. And then when you break it down for us and you explain it, it makes a lot more sense, really. I mean, I always come away feeling so much more relieved and reassured. So I think our public hopefully feel that way as well. Ayhan Ali has said, vaccine apparently lasts 3 months, and I believe a person still can catch the virus and spread it. So it's not a miracle cure, is it? So what's the point?
The point is you're protecting yourself. Your body's creating antibodies, and we don't know that for sure because the trials haven't been going on long enough. And we know that your blood cells replenish every 120 days. So for someone to say 3 months, that's only 90 days. So I don't know where he's getting his information from. And we know with the SARS virus back in 2005, people still have antibodies in their bloods today, and that's 15 years ago.
Yeah, so I think this goes a little bit back to medics are uber cautious about saying X will do Y. So they'll only say that the vaccine lasts as long as they got data for. So the vaccine's only been around for a few months. A few months, including the phase 1, 2, and 3 trials. So they'll never say it's effective for a year because it's just been around for a year.
And again, I think we go back to the point that the vaccine is not only to protect you, but it's to protect others. So I think that's very important. So it's not just about protecting ourselves.
And it will stop the virus in its spreads.
The protection directors told me I've missed out some questions. There's been so many. So I'm going to go to the bottom and then I'm going to work up and make sure that we cover everything. Fevzi has put everyone, viruses rotate all the time. Denmark announced the variant strain in September. I wish this government would be more direct and honest with us. So apparently there was, that has been on the news, hasn't it? That a variant was detected back in September. So what do we think? Is it the government not being honest, keeping it from us? Was it around from September?
I think they detected I think that my understanding was Porton Down Laboratories and the MRC, or what used to be the MRC in Colindale, they do the whole genome sequencing, and they identified this particular strain in September. But there's been lots of toing and fro with our WHO colleagues about this particular strain, and it's only when I think in Kent, when the restrictions weren't having an effect, that it became quite apparent that this was the variant strain. And that's where I think, and that became quite apparent in December. So I think although it was around in September, it's only now that we're beginning to see that that was the problem. The restrictions weren't working, the social distancing measures weren't working, purely because the transmission was a lot higher in Kent, and it spread over into London.
I see. I understand. So really, sometimes these things do take time to notice. But a point that was made last time, 2 weeks ago, was the fact that, you know, scientists more so than ever have actually started to really communicate with each other, not just within this country, but globally. And that's not happened before. So obviously that's hence why the vaccination has been able to get till the vaccine, should I say, has been able to be brought out sooner. It's not that, you know, it's not as safe, but it's just the fact that there's much more communication, obviously, because scientists are working much faster. Ilhan has made one other point. He's put the people who tested positive, are they getting vaccinated too? Because they should have some sort of immunization already for recovering. What do we think about that? Anybody want to answer that? Glenn, maybe?
Okay, so people who tested positive are, you know, the Joint Committee on Vaccines and Immunisations, JCVI, they've been very clear that people who are being prioritised for vaccination are the older and the vulnerable. That's right. So that's you know, and they're doing that on sort of very good like medical grounds of who's most vulnerable to the virus. So no, I mean. Yeah, and there's lots of debates about who should have it first. I think to some extent, once we get the program going, that becomes a bit academic. What we need is just people to take up the vaccine and roll it out as quick as possible.
Yeah, definitely. Well, Ilhan has said, thank you, or let's stay positive. So that means that after all those questions that he had, he's feeling positive. That's the effect you guys have. We're going to start rolling the program to a close. If we start with Mekella, any thing you'd like to share with our audiences? Any thoughts?
Just obviously keep doing what you're doing, washing your hands, wearing your mask, social distancing until we get this virus under control. Like I said last time, it's not going to go anywhere just yet. We need to eliminate it. By doing that, we have to be very stringent with the measures that we've got in place already.
Yeah, Fulya?
Yeah, I would echo what Mekella said. Absolutely follow the rules, follow social distancing, masks, washing hands, ventilation. But also, I mean, I hear what Ilhan's saying about people getting depressed. Talk to one another. Make sure people are safe. It's affected all of us, even those who are professionals. I mean, being long-term in lockdown, working from home, that less social contact, you know, speak to people, do Zoom meetings, talk to whatever organization can help you, talk to your families. I think it's important that we stay positive and we have as much support as possible to get through this.
Yes, we've got more questions coming. So before we have Glenn's lasting comment, I'm going to just read some of these. Right, Abu Hussein is put, why did Turkish Cypriot community suffer proportionally more than other ethnic communities?
Because we have underlying
health conditions.
Basically diabetes, high blood pressure, obesity.
Undiagnosed CVD.
Undiagnosed, CVD and stuff like that. I mean, my family was caught up in it. I had people testing positive. You know, they've overcome it, obviously, and I've lost people as well. But it's one of those things, unfortunately.
I hate to say it.
Sorry, go on.
Was it March or May? I can't remember which, but 91% of people who died had underlying conditions. And, you know, if you're sort of healthy, generally, I mean, not for everyone, generally, you get the COVID and get over it. I hate to say it, but smoking prevalence in the Turkish community is way higher.
Yeah.
And that really does seem to have had an effect on the Turkish community.
Yes, you're right. That's definitely one of the things, isn't it, that goes against you is that. Fezis, we don't know that other ethnic groups have been very badly hit, largely linked to factors around socioeconomic factors and those PPL on front line. Yeah, we agree with that. I mean, we've just
I think BAME communities have been disproportionately affected. Absolutely, because of the lockdown.
Cassius, but despite the recovering from COVID-19, the post confirming PCR test gets positive. Why and how?
Despite the recovering. despite the recovering
from
Yeah.
COVID and post.
I think
You might
this-
still have some. Yeah, carry on.
Mekella would know more about this than I will, but this seems to be that in some people, the PCR test, because it's very sensitive, picks up fragments of the virus still in the body, even if it's not the actual whole virus. So they'll still test positive, even if they haven't actually got the virus.
Yeah, that's what's been happening quite a bit, actually. A lot of people will test positive even though they're only having like a small viral load of a flu or something. It picks it up for some reason. So that's one of the things we're combating, because I've tested a lot of people that like have tests done who were positive and had no symptoms, and then tested people who've had symptoms and come back negative. So
so that sometimes there can be discrepancies, but I suppose with something like that, then you'd have a blood test or just isolate.
Isolate.
Yeah, and Ilhan has put PCR test is amplified 45 times.
I don't know where he's getting his information from.
Well, not. I would have thought more than that.
70.
Yeah, I thought it was way more than that. Actually.
Way more than that. It's so sensitive, PCR tests.
Yeah, they are.
Okay.
I mean,
Again, if you're showing symptoms, or obviously, like I know I got a text from my school because I work in a school telling me that I have to actually get tested before I go back. I mean, if you are invited to be tested or you are showing symptoms, the advice is to go and get tested. And obviously, if you've had direct contact or you're showing symptoms, you isolate. And if you are given the chance to be vaccinated, the answer is yes, right?
Absolutely.
Absolutely. But also, I think we have to mention that there is mass testing going on in Enfield as well. Glenn, do you want to say a bit more about that?
Yeah. So the mass testing, really what we're trying to do is pick up people who are asymptomatic and ask them to self-isolate so they don't pass the virus on. We've set up three mass testing sites at the moment. So Brigadier Hall, Kemp Hall, and Klinger Hall. Sorry.
Not Klingon.
We hope to Star Trek now.
It's getting late. It's been a long day.
I know what you watch then.
Definitely not Klingon Hall. Klinger Hall.
Klinger Hall, yeah.
Anyway, so we're hoping to set up more in the next sort of, this week and then more in January. But I'm going to sum up now. Actually, in terms of going forward, what we really need to do is stop the virus as much as possible, protect the old and the vulnerable, and that's through sort of testing and get vaccinated. That's and we've got a couple of months to go on this. If we're clever, we've got a couple of months to go on this. That's all we need. And in terms of people talking about mental health, they keep saying the way to sort of be optimistic is to have a little bit of a look to the future, and the light at the end of the tunnel is definitely getting closer.
Definitely.
I hope so. Is that your last words, Glenn? Because you were the only one that yes, that's a very positive way of ending the program. Thank you very much for all of you for coming on, and hopefully we'll have another one, and it will get more and more positive as we go along. But the lasting message is get vaccinated if you can, for sure. Absolutely. Okay, thank you very much. That's it from us. Thank you. Thank you to all our audiences for all the comments. That's it. Have a very good evening from Eurogench TV. Goodbye.
Thanks very much. Thanks.
Thank you. Bye.
Bye.
Biliyor musun? Erken rezervasyon başladı. Yazın en renkli fırsatları cyprusparadise.com'da. %40, %50 hatta %60'a varan kaçırılmaz indirimler. Erken rezervasyon yap, uçak bileti fiyatına paket tatili al. Uygun fiyata Kıbrıs tatilinin adresi cyprusparadise.com. Zaman akıp gitmeden acele edin. Bir bakmışsınız yaz gelmiş. Cyprus Paradise. Tatiliniz bizimle güvende.
Kalitenin, güvenin, hızlı teslimatın adresi Ancon Furniture. Ancon Furniture ailesi olarak yeni ürünler ile hizmete devam etmekteyiz. Yeni model koltuk takımlarımız, yatak mekanizmaları bir dokunuş ile açılıp bir dokunuş ile kapanabilmektedir. Bir dokunuş ile açtığımız yatak mekanizmasının yatak çarşafı kullanıma hazır, serili olarak içinden çıkmaktadır. Yıl sonuna kadar herhangi bir koltuk takımı alan her müşterimize akıllı sehpa hediyemizdir. En iyi ürün, en iyi fiyat. Sadece Ancon Furniture'da. Bize uğramadan karar vermeyin. En iyisini biz yapana kadar daha iyisi yok.